Why do we chisel surgeons make a big fuss about the alternative, i.e. drill surgery? The main reason is this. Research from the 1970s suggests that the noise of a drill removing bone from the mastoid bone, the outer ear skull bone, is somewhere between 90 and 120 decibels dB in intensity. Added to this is the sound of the suction, another 100 dB. And when the drill is not drilling, the suction is sucking. The noise is continuous. We know that, according to occupational health standards and countless research articles and experimental studies, that at 100 dB the safe period of noise exposure is around 15 minutes. At 110 dB it is only 5 minutes until permanent noise-induced hearing damage occurs. At 120 dB only 2 minutes. An average ENT surgeon takes around 3 hours to drill exostoses from one ear, and this noise goes to both cochleae. An experienced drill surgeon might cut this time down, but cannot possibly work within the proven safety limits. At very best, these limits will be exceeded by at least a factor of 4 times, even in the best of hands. So the norm appears to be a total of 6 hours to drill both ears. Some drill surgeons will do this in one setting. Consider this time relative to the safe exposure time, somewhere between 2 and 15 minutes, and you start to understand our concern. This extreme noise exposure explains why many people who have their ears drilled experience permanent tinnitus, and some will have permanent hearing loss as well. This becomes even more of a consideration when some surfers have to have the procedure repeated 2 or 3 times. These experiences have made thousands of surfers with troublesome ears refuse the surgery, and I understand that perfectly. I willingly drill into an ear where there is chronic infection, mastoiditis, or a tumour, or a growth called a cholesteatoma, because these conditions have life-threatening complications, and hearing is of secondary importance. The drill in these situations is the most appropriate tool, and can and must be used. But surfers for the most part have normal eardrums, normal middle ear bones, and normal cochlear function and hearing. And their bone is extremely hard and situated right up against the eardrum within a confined ear canal. These factors stand to worsen the extent of noise damage when a drill is used. It is for all these reasons that the chisel method, in my opinion, is to be preferred. By a long shot. Surfers who have had both methods done will unanimously say the chisel method was far easier to undergo. The facts that we do both ears in one go, that there are no skin incisions, that recovery is quick and discomfort is minimal are all bonuses. The most important principle of all medical treatment, and surgery especially, is to do no harm. Based on established uncontested scientific facts, the drill method presents a significant risk of permanent hearing loss and/or tinnitus. This might have been considered acceptable before there was an alternative without those risks. That situation has changed. The 20 of us worldwide who have embraced this technique have proved both its safety and efficacy. Any surgeon who is prepared to drill away surfers' ear bone should be willing to defend his decision and provide evidence that no harm will be done. I don't think she can, based on the evidence. The onus is on drill surgeons to prove their procedure is safe. In my opinion, there should be a moratorium on drill use for surfers' ear until such time that the research on drill noise is repeated and updated to give a clear contemporaneous assessment of the risks. We chisel surgeons have proven the technique and have thousands of happy surfer clients as a result. The surfing community has made it known without doubt that the chisel method is the one to be preferred. At the moment it falls on surfers themselves to spread the word that the newer chisel technique poses a far easier recovery without the risks of the past. It's time ENT surgeons across the board had that realization, made the appropriate recommendations, and learned the chisel technique for themselves.